I'm Rick Muir. I'm the Associate Director for Public Service Reform at the Institute for Public Policy Research.
I'm Jessica Walsh and I'm a Director of Healthcare at HealthUnlocked in London.
IPPR is one of the UK's largest public policy think tanks to try to influence the decisions that policymakers make, and also to try to shift public opinion in areas where we think it's necessary.
HealthUnlocked is a global communications agency and we have 70 offices in 43 countries around the world.
We wanted to find out how much power and control people with long-term chronic conditions had over their health and care. And so we really wanted to talk to a large number of people living with long-term chronic conditions to assess how empowered they felt in their day-to-day lives and in their interactions with the health service.
So we had a really difficult brief when we began working on this project with HealthUnlocked. I think we had about 2 weeks in total to turn around a survey of something like 2,000 patients. It was multiple country, multiple language.
Working with HealthUnlocked was brilliant because we managed to reach about 2,500 people within about 24 hours.
We were able to quickly develop a survey questionnaire that met the brief. We were able to field it very easily. And we all surprised ourselves almost with the results that we got back.
I think the research that we did with HealthUnlocked for the first time helped us gain a kind of quantitative picture of how empowered people felt over their care and support.
These days a lot of our clients are asking us how they can become more patient-centric, how they can bring patient insight into their business.
I think it was very impactful in demonstrating that the NHS has a huge way to go in terms of empowering patients and giving them more control.
I think what's really exciting about working with HealthUnlocked is that you are able to gain insights from patients that we wouldn't normally be able to reach.
We got a lot of just very personal stories and so on.
And I think the really interesting thing that HealthUnlocked is able to do is to identify the you and me kind of patient, the everyday patient.
The great thing about the HealthUnlocked work was that it generated a lot of statistics, which for us was very useful at drawing attention to the work, because people writing newspaper headlines quite like to have statistics to hand.
You get really high quality responses, you get a quick turnaround, the reach is truly global.
So anyone who's thinking about doing research with patients, I would definitely recommend working with HealthUnlocked.
And it's a lot of fun to work together.